So you might ask, how is brain-based therapy different? Well, it's different because we treat you neurologically and metabolically and both at the same time. That's what makes us different. We'll start off by doing a complete neurological and metabolic workup. Well, what's included in the workup? Well, one thing we might do is a thyroid panel. Now, most thyroid panels I see only include TSH, which is thyroid stimulating hormone. We need to look at TSH, but we also need to look at free T4, total T4, free T3, total T3, reverse T3. We also need to look at thyroid antibodies. Many patients who have a hypothyroid or a sluggish thyroid are suffering from Hashimoto's, which is autoimmune disease against your thyroid, which means your own immune system is attacking your thyroid tissue, throwing off your tests. If that's the case, we need to treat you from an immune standpoint, not only a thyroid standpoint. So next, we'll do a complete metabolic panel. This is where we look at your calcium and your potassium levels, we look at your glucose, because your brain needs a constant supply of glucose and oxygen, so that's an important panel. Next, we might do a lipid panel. We'll look at your cholesterol, the good and bad cholesterol, the HDLs and the LDLs. We want to see what those levels are. Then we'll do a complete blood chemistry with autodifferential. This allows us to look at you for signs of anemia. We can also look at your lymphocytes, your neutrophils, and also your eosinophils. If your eosinophils are high, that means you do have an allergy or possibly a parasitic infection, and we need to do further testing to get to the bottom of it. That brings us to the sensitivity test. This is actually a DNA test where they swab your cheek with a swab just like they do on CSI. This will look for sensitivities to gluten, soy, milk, eggs, or yeast. If you have a food sensitivity, it must be handled. If you have a food sensitivity, you will feel chronic pain or fatigue. You'll have frequent indigestion. You'll feel bloated after you eat. You'll have frequent loose bowel movements, constipation. You may have mouth ulcers or sores. You may vomit often. You may have to clear your throat often, or you may have excessive snoring.